Today we're announcing an important milestone in the automation of healthcare information in Ontario. It's the launch of an electronic hospital report manager that accelerates the flow of patient reports from the Royal Victoria Hospital to their family physician at the Berrien Community Family Health Team. This is the first one that can be adopted by any hospital and physician practice across Ontario.
So the project has been in the works for about a year now, and it's been a collaborative effort between the Berrien Community Family Health Team, the Royal Victoria Hospital, Ontario MD, and the North Simcoe Muskoka Lynn, ND Health Ontario. Now, what's really exciting about the report manager is that it has immediate impact on patient care. And this new tool allows me and my colleagues to get quicker access to test results that our patients have at RVH. Quicker access really means that we can treat our patients in a more timely fashion. In the past, if a patient were to have a CT scan at RVH, it could take as long as 12 days for those reports to get back to a physician. So between transcribing the results, putting them into a physician's mailbox if they did have one at RVH, or putting them in the regular mail or sending by fax, you can see the process and possible delays are really quite evident there. And for every extra day it takes to get results back, it's an extra day of anxiety and waiting for the patient who just wants to know their results and what the next steps are if further treatment is needed. If results were needed before they were received in the office, the physician staff would then need to spend significant time hunting them down. So the new system means that results can be sent to the primary care physician as soon as they're transcribed using a specially developed computer application that pushes these reports out to the report manager. Every 30 minutes, the reports are pulled from the report manager into CliniCare, which is the EMR that we use in the family health team. These results are then automatically linked to the patient's record so that the physician doesn't have to go searching for the results. They're right there when we need them. So if you consider that there are 50 or 67 doctors in the Berrien Community Family Health Team, with up to 500 reports being generated a day, it's a lot of information and a lot of paper too that we will no longer have to use. So it's great for the green. Of course, before the system was implemented, we did a lot of research and investigation to ensure that patient confidentiality was not compromised.
I am a registered nurse by profession, and I'm also a patient of Dr. Duval's. And as a registered nurse, I am used to dealing with patients waiting for test results, waiting for a diagnosis, waiting to start treatment. And it's a very anxious time for them. And 6 weeks ago, I got to be one of those patients, and I got to experience firsthand just how much anxiety they go through. After weeks of feeling unwell and not being able to keep up with my usual routine, I went to see Dr. Duval. I'd been having various illnesses off and on for the past year, and we just couldn't get an exact cause. But this was a Monday morning, and I came to her office, and she did the examination, and decided at that point the best option for me was to go to RVH Emergency, have further assessment. We knew we would get the test results back quickly. I had a specialist appointment a couple days later, and we wanted to have those results available for that appointment. Once I was in Emerge, very quickly we realized there were some significant changes to my health. As a registered nurse and as a patient, I was very impressed with the speed in which things progressed. I know how long it can take. And I know firsthand, certainly now, what waiting can do, how anxiety-provoking it is, how your mind can start to play tricks on you and run wild. It's very daunting waiting for test results. So getting the results quickly and getting connected with the right physician and the right specialist helped to reduce my anxiety, the anxiety of my family, and it helped us to start dealing with the known and start making a real treatment plan. As for me, we still don't have all the answers yet, but we are getting closer. I am responding to treatment, and I am feeling much better than I was 6 weeks ago. I have a confidence that the system works, and I feel that I'm being very well looked after, and that's important to me as a patient, and I think that will be important to all patients across Ontario, and it's a very good thing for our healthcare system.